My name is Jim Markert. I grew up in Los Angeles, California, a suburb of Los Angeles, and then I've lived all over the country since that time. I went to college in Boston at Harvard, and then I went to Columbia University in New York City for my medical school, and I went to University of Michigan in Ann Arbor for my residency program, then a couple of fellowships too, so in Chicago and back to Boston, and then came to UAB back in 1996. Growing up, I was, like I think a lot of doctors, interested in biology and different kinds of sciences, and had a couple of key internships. I was also very interested in becoming a doctor. I'm a member of the Baha'i faith, and being a physician is one of the occupations that really serves humanity, and so that fit that requirement for me. And then I think as I went to college, I got exposed to physicians. I did an internship as part of an in-depth independent study with a physician there too. So all those had an important impact on me and in my decision to become a physician. My personal interest is in brain tumors and other kinds of cancers. And while I was in residency, I started doing work with somebody at Massachusetts General Hospital, and we worked on genetically engineered viruses to treat cancers. And at that time, this was 25 years ago I started this, we had just developed the ability in science to be able to do genetic engineering of viruses. And so that was a new thing. And we actually took a herpes simplex virus, the virus that causes cold sores, and used a genetically engineered version of that would have normally been virulent or toxic to the brain, but because of the genetic engineering, it wasn't, and it still killed brain tumor cells. There's a particularly devastating kind of tumor called a glioblastoma that is universally fatal, and so we've been working on treating that tumor in particularly with herpes virus and other kinds of viruses. And that's really evolved into a real passion for me, and we're excited. We've developed new treatments here, even while I've been here at UAB, and have taken them from the laboratory bench all the way into treating patients in clinical trials. 80-hour work weeks are, standard for residents. I think that's sort of the limitation right now. When I was a resident, there wasn't any limitation, and I had many nights where I was on call every other night, and even the night off call, I'd be there till 11, 12, or 1 o'clock in the morning, then have to get up and do it the next. So it was scary. I mean, I would, fall asleep at inappropriate times and so forth just from being so physically fatigued. Lots of best experiences in surgery, I think. So it's and similarly, there are some terrible experiences that happen. When a patient doesn't do as well as they want. I guess I vividly remember the first time I clipped an aneurysm. It's a big day in any neurosurgery resident's career when you first are entrusted with that. Aneurysms are difficult surgeries often, and they involve the possibility of the aneurysm rupturing and causing catastrophe intraoperatively. So to actually be a surgeon and apply a clip and eliminate this problem from the patient is very thrilling, very exciting when it goes well. But you also, one of the things that makes it so exciting is that if it goes the wrong way and the aneurysm ruptures, it can be devastating for the patient. So I certainly remember that. And I think that there are plenty of times when we've had patients that, there's been unexpected intraoperative events like maybe an aneurysm rupture or unexpected brain swelling when suddenly things are, get rather dicey for the patient. And those are very stressful times for the surgeon. We've all had that happen to us throughout our careers, and every one of us has times that they remember that they wish things had gone differently. These tumors called glioblastomas, which start in the brain, don't come from anywhere else in the body but just originate right in the brain, are terrible tumors. They're devastating, they're infiltrative. We always tell patients and their families, because it's quite an accurate description, I think, they send little tentacles or fingers of cells out into the normal brain. So we as surgeons can help. We can make a big difference by taking the mass, there's almost like a central nugget or nucleus of the tumor that we can take out. But these spreading fingers that go on and involve normal parts of the brain that are still functional, we can't take out. If we took those out, these things are occurring at a microscopic level, we would disrupt all these pathways and destroy normal nervous tissue, and as a result, the patient would wake up unable to talk, unable to move, etc. My work with patients, I can't imagine anything more rewarding. I mean, the opportunity to go in and help another human being at a very basic level when they're concerned about their life, their neurologic function, even their very personality and being. I mean, you know, what greater privilege is there? Every time, you know, we look at the brain, we think, gosh, who gets to do this? This is such a privilege. It really is.